So good morning, everybody. And on day 3 of the South Asia SBCC conversations, I welcome you to the session on effective implementation. All of us who are SBCC practitioners know that, no matter how beautifully you design a project, unless it is effectively implemented, many things it's basically then going to fail. And so it's very important that we listen up to the insights that our colleagues are going to share with us today. The first presentation today is on a topic about which we have all obsessed, which is risk communication and community engagement for COVID-19. Our presenter today is Dr. Apurvakumar Pandya. Dr. Pandya is a psychologist by training. He is the director of the Parul Institute of Public Health at Parul University in Vadodara. He has more than 15 years of experience, and his areas of research include health promotion, studies related to policy, studies related to the mental health component of the public health system, and service delivery to reduce health disparities and inequities. He has been awarded, he's received numerous fellowships. He was a Fulbright Nehru Scholar, the UGC Research Fellowship, an Early Career Scholarship, to name just a few, and he has more than 55 publications to his credit. What he will be sharing with us today are the findings of a very detailed and systematic literature review focusing on risk communication and community engagement. Before we begin the presentation, I'm going to request all of you to please mute your computer audio so that everybody can hear the presenters without any disturbances, and to post your questions in the chat. We'll take the questions up after all 3 presentations. So with that, over to Dr. Apurvakumar Pandya. Dr. Pandya.
Hello, hope presentation is visible.
Yes, Dr. Pandya.
And okay, thank you very much. So on behalf of my colleague, and I am going to present a brief presentation of our systematic review on risk communication and community engagement practices that provide better evidence for COVID-19 management in India. So I'm going to skip this context, as we all know COVID-19 context in India. But I would like to mention that the study that we have conducted at the time when we were going through a very tough time of COVID-19 wave 2. So during second wave, we tried to carry out this systematic review. So we basically used a rapid systematic scoping review as a methodological approach, and with an objective to identify and summarize the diverse evidence on risk communication and community engagement in the context of COVID-19 in India. We used a PRISMA scoping review guideline as well as NTWAC, that is enhancing transparency in synthesis of qualitative research. We used the NTWAC because many of the document or records that we found related to our interest of topic were not actually scientific or empirical research, but it were descriptive documents. Therefore, we had a lot of qualitative information that we tried to synthesize here. So we primarily search literature from 3 major databases, that is PubMed, Scopus, and Google Scholar. We targeted to search scientific published literature as well as gray literature such as newspaper articles, blogs, and reports and the description provided on different websites of the organizations. So we follow that, and we primarily included those studies which were published in English, and study that in the documents and records that were explaining or talking about risk communication and community engagements during COVID-19, and many program reports as well as empirical studies. So out of 1260 records that we could find during the search, we selected 29 records for our study. So we presented results into two groups or two divisions. One is key functions of risk communication and key community engagements. So we identified, based on this literature, 5 functions of risk communication that have been documented or implemented by various functionaries and machineries of the government. So the first was providing factual information. So it was very evident that various information, education, communication materials were developed by the government, and there was also engagement of public-private partnership where few institutions were, providing the factual information related to COVID-19. As we aware that the infodemic, that is, overload of information, and at the time it is very difficult to identify which information is accurate. So that providing factual information has been a very important strategy of risk communication, which there have been few evidence related to that. Another important risk communication function that we could find from the literature was mitigating impact of COVID-19 on marginalized people. So we come across one of the Niti Aayog's guideline to dealing with marginalized people. There have been various civil service organizations who came together and engaged with marginalized people. For example, UNICEF's Hello Didi program and UNICEF and Public Health Foundation of India came together and organized some activities, and National Service Scheme organizations has also carried out some activities focusing on marginalized people. The third point was encouraging COVID appropriate behaviors. There have been social media, mass media campaign, and we identified one program in Gujarat and even Delhi, where this mass media campaign was a little different from others, that they moved from providing information to news channel or maybe in social media, but there were also examples where various street plays or namaste campaign or other street based campaign was given, where in a local language, in local dialect, information about COVID-19 and appropriate behavior was executed. Building resilience, there have been initiatives for addressing issues of frontline workers. National helpline was established. Psychosocial helpline was also established in Gujarat for COVID-19 positive people, as well as their family members and in people in general. And also there have been some initiatives proposed by University Grants Commission for students. And restoring trust in health system, there have been a few examples which we come across from the literature, that there have been public announcements related to public healthcare services, daily press conference in Gujarat talking about the current state of health system and healthcare services in Gujarat, daily COVID-19 statistics. These are all some examples which were relevant to restoring trust in the public health. So moving from risk communication to community engagements, I will quickly go through the 5 key community engagements that have been reported in the literature. Was local actions by political leaders that has also created impact in accessing certain COVID-19 related services. One of the example is one of the MLA in Surat has created COVID-19 care centers for the community around Surat, and that has been it has been one good example. And currently that person is a minister taking care of few portfolios in the state. Community-based and faith-based organizations have also came forward and contributed in establishing COVID isolation centers. There have been examples where faith leaders sending messages about COVID appropriate behaviors to the community, to the masses, that were also perhaps created some positive impact. However, there have been no studies, assessing the impact. We have just documented what has been done so far. There have been examples of individual volunteers coming to the community and helping. So there have been some examples of Bollywood actors who are supporting community members, as well as few anecdotal examples from various states. And one example I would like to mention here is one youth who is a community radio producer, talked about vaccine in her community radio, and today that particular village is 100% vaccinated. Self-help group, there have been tremendous role played by women's self-help group in preparing and distributing masks in the initial phase, and various activities related to COVID-19. And communicating with vulnerable population has been one of the important community engagement aspect, where one example is UNICEF Uttar Pradesh has developed a puppetry series for adolescent girls, and engagement with stakeholders and key people. So there have been, some government and some organizations proactively engaged with key stakeholders, key individuals to come forward for helping and creating, contributing in COVID-19 issues. So some of the challenges with that have been reported to be challenges or barriers in creating effective risk communication and community engagement. The first barrier, which we have perhaps here is not mentioned, is that most of the risk communication and community engagement that have been reported were not planned but mostly ad hoc. So because of the crisis situation, certain activities were planned and executed. However, when we prepare risk communication and community engagement activities, we could have prepared a plan, and it can be executed involving multiple stakeholders. So another challenge was infodemic, that is overload of information, where we do not know what information is accurate, what information is inaccurate, what are the misinformation, what are the rumors. So we need a systematic approach to address infodemic at various levels, right from the central government level or a federal level to the community level. There have been diversity of language, therefore any communication strategies that we develop has to be contextualized in the local language, and India being a very diverse, it was a challenge. So certain best practices were limited to certain area or certain region. There have been cultural practices which were against COVID-19 protection. Therefore, we also need to take care of that. We need to address, cultural aspect and a religious aspect, integrate into our risk communication. There have been restricted financial resources, but particularly for risk communication and community engagements. Of course, limited public literacy as also one of the challenge. So there was a limited scale of best practices because it was at a individualized level or at a regional level, and there have been few incidents, very unique incidents that has happened in COVID-19 second wave in India. First was panic buying, dealing with scarcity of essential medicine and black marketing of medicine, hospital beds, and COVID-19 preventing products. So these were the area where we could not find very much about risk communication and community engagement exercises. However, these are the areas which we must keep in mind for our future public health emergency or any re-emerging public health issues. So for a discussion, we have identified 4 areas where we think that we need to work on that collectively. The first is we need to have a contextualized guidelines and action plan for risk communication and community engagement.
Dr. Pandya, can I hurry you up just a little bit?
Yes. I will just going to end this. So planning and executing RCCE at a multiple level, we need to have not a short-term, but a sustainable target-oriented RCCE for vulnerable population. Need to have a comprehensive training for people so that they can continue this campaign and collaboration with like-minded organizations, experts, and community volunteers. And with this, I would like to thank you for listening to me.
Thank you, Dr. Pandya. We're going to come back to you with questions. I'd like to take a question that's posted on the chat live. So we'll do that after all 3 presentations. But thank you for this very thoughtful study that you have shared with us. Now, the second presentation of this session is going to tell us about a Gates-funded project called Naya Qadam. Naya Qadam addressed cultural barriers and a lack of community acceptance of family planning. The presenter is Maheen Dhanani, the project officer for SBCC, and also the chief of party at Pathfinder International in Karachi, Pakistan. A very warm welcome to Maheen, and many thanks to you for sharing your work. The floor is yours, Maheen.
Thank you so much. I do believe there was one mistake in my bio, though. I am not the chief of party, but thank you so much for that introduction. I do believe that my presentation will be presented as pre-recorded. If I could get some assistance with that.
Apologies, Maheen. Maybe I'm predicting times to come. And Vaishali, could you please start
Fingers crossed.
Presentation?
Hi everyone, my name is Maheen Dhanani. I represent Pathfinder International, and today I will be talking about our project called Naya Qadam, which means a new dawn in English. So an estimated amount of 9,700 maternal deaths and 245,000 neonatal deaths occur annually in Pakistan, and around 64% of these women have the unmet need for family planning during their first year postpartum. To reduce the risk of adverse maternal and child health outcomes, WHO recommends 24 months interval between birth and the next pregnancy. Early and close-spaced pregnancies, as well as a high total fertility rate, threaten the health and well-being not only of Pakistani women, but of their newborns, their families, and their communities. Recent data from the Pakistan Demographic and Health Survey show that 34% of births occur within a birth interval of less than 24 months. And the unmet need for family planning is 64% in the first year postpartum. Postpartum family planning services are considered effective and also cost-efficient approach. Provision of FP services during the postpartum period are considered effective and cost-efficient, but it is often missed. Given the high unmet need for postpartum family planning and to improve health outcomes, Pathfinder International initiated the Naya Qadam project in 6 districts across Sindh and Punjab. This project is funded by the Bill and Melinda Gates Foundation and aims to increase PPFP uptake through expanding public and private sector services, contraceptive method provision, and increasing method choice. The consortium of partners for this project consists of Green Star Social Marketing, the National Committee on Maternal and Neonatal Health, AHANG, Shirkatgah, and IPAS. And this was conducted in partnership with the government of Sindh and Punjab. So our intervention for this project focuses on increasing post-pregnancy family planning uptake and expanding method through the public and private sector. Naya Qadam's human-centered design approach strengthens public and private health systems and creates an enabling environment for the provision of quality and accessible PPFP services in both provinces. We carried out an extensive SBCC campaign that reached over 4 million people in Pakistan, trained health providers, upgraded health facilities, developed a family planning implementation and education plan, including the Lady Health Worker LHW curriculum in Sindh, and the LHW referral strategy provided support to the Population Welfare Department. With that, establishing and equipping a post-pregnancy family planning skill lab in midwifery schools, partnered with the Department of Health in Sindh and Punjab, and strengthened the district health IS by successfully integrating PPFP specific indicators into the DHIS systems of Sindh and Punjab and collecting routine disaggregated PPFP information. Pathfinder has introduced a counseling-centered integrated approach to post-pregnancy service delivery, addressing the widened gap between service availability and unmet need by rapidly upgrading lady health worker community midwives and the lady health visitors' capacity to offer services through redesigning antenatal care as a comprehensive approach of pre-service capacity building, in-service mentorship, in a comprehensive youth strategy, community mobilization, and demand generation, facility-based system strengthening, public-private interventions, and enabling social and policy environment. This project has increased PPFP uptake amongst young women aged 15 to 24. A total of 1,000 public and private health facilities are currently providing PPFP delivery services, and this was initiated in May 2019 and ends in November 2021. For the results and lessons learned during July to September 2018, Pathfinder International Pakistan conducted 50 pre-service and in-service capacity building training, where 697 service providers were trained on clinical PPFP. A total of 249 health facilities upgraded to enable them to provide comprehensive PPFP services. Further, 7,300 lady health workers and 365 lady health supervisors were trained between August and September 2019 for community mobilization and demand generation activities. In October 2019, these LHWs conducted 70,500 support group sessions where 939,000 women were counseled on PPFP services. And so in order to improve service quality, Pathfinder visited 147 service providers for mentorship and provided on-job training. Moreover, during May to September 2019, a total of 138,680 women received FP services within 1 year after their last delivery, and 51,000 women received FP services within 6 months after their last abortion from around 8,000 facilities. Close partnerships, in-depth engagement with government representatives across all management levels, and technical hand-holding proved to be key in the success of the project. The main challenges that we faced with our Naya Qadam project were lack of community acceptance of FP and cultural biases against FP, particularly for the younger people among providers and community members, created barriers and reduces access. So for this project, we had a dedicated project-specific monitoring, evaluation, and learning team who closely monitored the project performance, cost effectiveness, efficiency, and equity in the project. And Pathfinder is building upon the successes and lessons learned from this project by focusing on health system strengthening to achieve sustainability and scale, with considerations towards equity and gender equality. Major achievements of this project contributing to sustainability were the development and approval of PPFP and PAFP policies, institutionalization of PPFP and PAFP indicators in the DHIS, the development of curriculum and training modules, regularization of DTC meetings, a upgradation of lady health worker referral mechanisms, the capacity building of HCPs and outreach workers. With this, we also achieved complete ownership of the government for the Naya Qadam interventions. And with this project, we were able to bring the community's voice in planning and implementation with extensive engagement of youth champions, male allies, CBOs, and achievement of all our outcomes by the project was within our planned budget. Thank you.
Thank you, Maheen. That's very, very intensive work, and I congratulate you on it. I'm going to come back to you because this is an SBCC conversation. And, my big question to you is that it would be fascinating to hear more from you after Deepali's presentation on how you address the mindset. You mentioned that, there's great resistance at the community level. And what I see is that you've done a lot of system strengthening. I'd like you to think about that, and I'm going to come back to you on that. And with that, let's move on to our final presentation, which is about violence against women and girls. Now, the violence that women faced in their homes was a particularly heartbreaking problem that was exacerbated by the pandemic. What we saw during lockdown was that women were locked at home with abusers and with very little access to help and support systems such as helplines. Deepali Desai, who's the Senior Manager for Media Advocacy at Breakthrough, is going to tell us about their work on this particular issue. Thank you for that, and over to you, Deepali.
Vaishali, may I request you to play the presentation, please?
Oh, yes, ma'am, sure.
Hello everyone, my name is Deepali Desai and I am from India. I'm currently associated with Breakthrough India, an organization seeking to make violence against women and girls unacceptable. I was a former journalist and currently work with Breakthrough as Senior Manager for Media Advocacy. The topic I want to address today is building media as credible stakeholder against violence against women and girls is on the basis of my experience working and indulging with Indian media platforms during COVID-19 pandemic, first and the second wave. Hello everyone, my name is Deepali Desai and I am from India. I'm currently associated.
Vaishali, there's a problem.
COVID-19 pandemic pushed the Indian government to impose total lockdown in March 2020. But a nation as wide as ours had many social implications as soon as people were confined to their homes. Panic, confusion, loss of livelihood, especially directly affecting the daily wage workers. Immediately, we saw a massive migrant crisis unfolding, where several thousand people were seen walking on the road to reach their hometowns as haphazard lockdown had put halt on all modes of transportation. Simultaneously, there was a rise in COVID cases across the country. And while these were the immediate visible problems, remember, several women and girls were left vulnerable, confined to their homes. The hotlines run by the NGOs and voluntary organizations were left out from essential services announced by the government, resulting in many losing the avenue of immediate help and rescue. Activists and experts fear the continuous presence of abuser at home may increase violence against women, and in many cases, there would be no avenue to report the violence and no help in many cases. Before we speak about the role of media, let's understand the situation on ground in India in the context of violence against women. According to National Family Health Survey, more than 25% of women face domestic violence in India. 1 in 3 women face violence from intimate partners, yet only 1 in 10 of these women formally report the offense. According to National Crime Record Bureau, daily 10 cases of rape on Dalit women are being reported in this country. Women and girls with disabilities face 10 times more gender violence. Now, just imagine that in the context of lockdown when these vulnerable sections were confined within their homes, perhaps trapped with the abusers. As expected, there was a massive rise in crime against women during pandemic. The country saw a rise of 46% in complaints during first 8 months of 2021. Between January and August this year, close to 20,000 complaints were received by National Commission for Women. Around the same time last year in 2020, over 13,000 complaints were reported, July being the highest with 3,248 complaints of violence. Most of these complaints were received from Uttar Pradesh, while the highest complaint rate was recorded in Delhi, which is also India's national capital. Hence, the role of media was extremely crucial because it was the only platform. Hence, the role of media was extremely crucial because it was the only platform that could connect with the on ground realities during the lockdown and the policymakers at the center at a time when none of the announcements were made towards ensuring the safety of women and also the healthcare. COVID-19 crisis posed a serious threat to several aspects of women's rights, including reproductive rights, economic rights, and other freedoms. Women play a prominent role as caregivers within the family and as frontline health workers. During peak wave of pandemic, women were also affected when resources for reproductive and sexual health were diverted to emergency response. We needed media's attention to highlight the issues. Despite the warning from civil society members on probable rise of cases of domestic violence within homes and to alert the government to take action, media took longer to acknowledge the problems on ground. We have been struggling with lack of space to highlight gender sensitive issues already. Ability to understand the subject matter by the top level editors, lack of gender beat specific reporters, in my opinion, are one of many reasons for the delayed response. One of the ways to indulge with media was through different campaigns because we acknowledge that media has to be involved at a time of these crises. So we collaborated with several digital platforms to disseminate messaging while always interacting with media on issues. During this crucial time, Breakthrough launched campaigns encouraging bystander intervention in cases of violence against women and girls. We collaborated with Twitter India for Each One Reach One campaign, where we connected with several influencers, journalists. One of the ways to indulge with media was through different campaigns because we acknowledge that media has to be involved at a time of these crises. So we collaborated with several digital platforms to disseminate messaging while always interacting with media on issues. During this crucial time, Breakthrough launched campaigns encouraging bystander intervention in cases of violence against women and girls. We collaborated with Twitter India for Each One Reach One campaign, where we connected with several influencers, journalists, media houses to create conversation around gender impact on women and girls during the lockdown. Another campaign, Unite Against DV, engaged with several personalities from TV and film industries in India to spread messaging around active bystander intervention. We were constantly disseminating a collated list of operational domestic violence helpline numbers across India in multiple languages. We had enough evidence from Breakthrough's most significant campaign, Bell Bajao, that we launched in 2008, that positive active bystander intervention can be deterrent to temporarily stop the violence. Lockdown and isolation policies posed women at higher risk of domestic and sexual abuse. Restrictive mobility and less external interaction apart from families were one of the biggest challenges. We used media platforms to share editorials, frequent press releases raising these issues relevant to lockdown. We also aligned with partner organizations and, with their help, collated ground stories. We identified journalists willing to write on gender issues, and emphasis was given on appropriate headlines, photo representations, along with relevant issues to be raised in media. We define media with print, digital, television, and radio platforms, both in English and vernacular languages. Most of Breakthrough's intervention states record highest rate of crime against women in the country. We are aware that with the advent of new media, that's digital platforms, we now have more space to write about gender, yet we are facing challenge to get reporters to take interest. While most watched platform of media is still television, yet we see oftentimes many stories related to crime against women become TV debates for politicians to blame each other, and that's it. From there is not much scope for advocacy. Over sensationalization and misrepresentation of women and girls while reporting on violence against women and girls reinforces regressive cultural norms and unwittingly perpetuates a victim blaming attitude. Such problematic media practices can be replaced with sensitive and affirming methods that upholds the right and dignity of survivors of sexual violence. Sustained conversations on gender issues is crucial for capacity building on the subject matter. And that brings us to why media advocacy is important. It helps to amplify the issues of violence against women and is a strategic use of media to advance policy initiatives, campaigns, and to build awareness. Media must recognize its role in making violence against women and girls and other vulnerable sections unacceptable. Breakthrough has thus developed a guidebook under Redraw Misogyny to sensitize journalists with appropriate usage of jargons, graphics, images that help to practice ethical journalism while covering gender sensitive stories. So far, we have trained around 150 journalists in our intervention states, that is Delhi, Uttar Pradesh, Haryana, Bihar, Jharkhand, through several workshops and training sessions. We have observed that consistent intervention help a journalist perceive stories on violence against women with better sensitivity and balanced coverage. And that brings us to why media advocacy is important. It helps to amplify the issues of violence against women and is a strategic use of media to advance policy initiatives, campaigns, and to build awareness. Media must recognize its role in making violence against women and girls and other vulnerable sections unacceptable. Breakthrough has thus developed a guidebook under Redraw Misogyny to sensitize journalists with appropriate usage of jargons, graphics, images that help to practice ethical journalism while covering gender sensitive stories. So far, we have trained around 150 journalists in our intervention states, that is Delhi, Uttar Pradesh, Haryana, Bihar, Jharkhand, through several workshops and training sessions. We have observed that consistent intervention help a journalist perceive stories on violence against women with better sensitivity and balanced coverage. And that brings us to why media advocacy is important. It helps to amplify the issues of violence against women and
So thank you for that. Apologies for the technical glitches. This is really important work, and thank you very much for sharing it, Deepali. I'd like to open the floor for questions to our panelists. Let's get the conversation going. And Varinder, I'm going to ask you to unmute yourself and ask your question in person to Dr. Apurvakumar Pandya.
Sure, Ragini. Thank you so much to all the three presenters. This was really fascinating work. Dr. Apurva, my question, I'd also asked it in the chat. I was just interested in knowing that, when you're, you looked at over 1,000 reports, right, to come up with the best practices on COVID communication. So I was just wondering, where did you see more lapses? Because when you're looking at the report, at what level, you did share some of the considerations of how you brought it down to 29. But I'm trying to start my video. I think it's my internet bandwidth is not allowing it. But it'll be good to sort of hear from you if, when we're basing the COVID communication best practices on these 29 papers, what gave you that confidence that these are the best 29 papers and one should be looking at when you're looking at, any good practices?
Yeah,
Thanks.
Thank you. Thank you for this question. So actually, we had, when we did a literature search, many of the literature and many of the documents and records that we found were not particularly based in India. Although we had kept India as one of the keyword, but we received many documents which were not in India, not from the India. So we what we did, we separated those, and of course we are having. We are working on another paper which is focusing on RCCE at in the global context. So we removed that. There were many other, kind of the newspaper articles or newspaper reports where we tried to contact the reporter to find out details. But many of the newsletter articles were very brief and they have not detailed out the communication strategies or community engagement. They have just reported that happened. So we wanted to know, how it has been executed, because the purpose was to understand the RCCE practice. So then we did not get a response. So we have to remove those articles also. So actually 29 is from 44 records that we actually selected for full text review or for our review. From 44, we had to, because we did not get any response from the writer or maybe reporter or maybe author, we have put that studies on hold and we just reviewed 29, where details of the steps of risk communication, who are the stakeholders, how it was planned, whether it was particularly in association with government machinery or it was an independent task. That few questions that we had were clarified and we included.
Okay. Thanks. Thank you so much for that, Dr. Apurva.
Thank you, Varinder. And let me introduce you to the group. Varinder Kaur Gambhir is the Director for Research at BBC Media Action. And you could see the researchers speaking to each other on the literature review and its very creditable rigor. I'm going to invite all of you to unmute yourselves and to share with us a key takeaway that you have from this discussion. So anybody in the audience who'd like to, please unmute yourself, introduce yourself, and talk to us about what struck you. Are there any takers? While you gather your thoughts, I'm going to take my advantage as a moderator. Maheen, I think what you described is absolutely fascinating and really uphill work. I'd like to hear a little more from you on overcoming resistance on the part of young people to adopting modern contraceptives.
Thank you so much, Ragini, for asking that question, and I'm very happy to talk about it. And I know that you mentioned mindsets earlier as well. And for this campaign for Naya Qadam, the SBCC campaign, we took into account a lot of systemic barriers to information that exist for women and young girls in the operational context. And these barriers are very deeply rooted because of unfavorable cultures and gender norms in Pakistan that we can see, which are limiting women's access to, let's say, information, or curtailing their agency, or even restricting their mobility, in many social spaces. For example, at the individual level, we see for knowledge beliefs and for attitudes, or in the household level, we can see there's interspousal communication barriers. And keeping in mind the context of COVID-19 with social distancing and restricted social movements, we had to align this social responsibility towards activities. I can give you a quick example of how we approach the individual level towards women and girls. For example, in our communication channels, we took the context of key influencers to women's health behaviors so that we can engage them with the messages. We included channels like youth champions. We had a helpline and service providers. We took advantage of digital and mass media. And also, like how I mentioned in the presentation, we had lady health workers and community midwives. And these were great resources because they acted as trusted intermediaries to reach these persons.
Yeah, so what I'm hearing you say is that basically providing a trusted intermediary to give information was critical to changing mindsets. Is that correct? So it's a lack of information, that if people have information, they are going to act. It's the provision of information and from a trusted source that is critical to post-pregnancy family planning uptake. That's your key finding?
Exactly right, yes.
Okay. It's very interesting because in India, we have found that there is very high knowledge of family planning and relatively poor uptake. So there's more a fear of, modern contraceptives and the infertility they may cause. But it's interesting to see. I think you have such high levels of, 64% unmet need in the first year, that perhaps this was the crucial aspect. But perhaps it's something that you would consider exploring, what are the other barriers when you talked about gender norms? It's not just about access to information, but also maybe access to decision-making and multiple, the ability to take decisions that concern your body and your health. It's really quite a problem to untangle. We have a question from Varinder to Deepali. Varinder?
Hi,
Varinder.
Hi. Thanks, Ragini. Deepali, if you've got a chance to see my question, I was just, of course, it's fascinating really to see the work that you've done on media advocacy and, capacity building of the journalists. So I'm sure you would have faced a lot of challenges. We also know, the kind of environment we're in these days. So just wanted to know, what were some of the challenges when you were trying to use media to, say that UP, for example, is one of the biggest states when it comes, we talk about gender-based violence. The data there is seeming to be pretty bleak.
Yes.
And how did you really overcome, these kind of challenges? Yeah, thanks.
I think one of the biggest challenges, breakthrough works in Uttar Pradesh, Haryana. You used to work in Bihar, Jharkhand. The key challenges is, and also, so we deal with two factions of media. That is, one is national media, mostly English in Delhi and urban cities. We also have begun our work in Punjab. And vernacular media when it comes to UP, Haryana. The challenges, the key challenges are the fact that even if we are, trying to connect with the reporters on the certain stories, it is, and my whole presentation is about the experiences we had during even the pandemic and even before that. One of the things that India, we had already seen the reports coming out, if I'm talking particularly about the pandemic and the challenges during that. We had already seen the aftermath of lockdowns already coming from Europe. So we had considerable amount of data. What is happening in the western part of the country, western part of the globe, where we could really see that there are cases of domestic violence. Brazil, for example, they were we could see that there are reports trickling in. Even before that, we had the reports from Africa during Ebola and Zika virus lockdowns, that there could be possibilities of domestic violence. One of the key things that we think when we are dealing with individual levels of reporters, while they talk to us, we communicate at the daily basis, but they are also aware that you will give us the story, but whether our editors will give us space to publish. And this I'm talking particularly about the print media. And there are different challenges. But for example, when we're talking about the print media, there's a lack of scope of writing there. There's a space problem. TV, we hardly see any kind of debates. Specifically, when we went to the media, in April 2020, that look, they could be, and even then we didn't have the NCW data coming, and they were the first ones to actually report that there are cases of domestic violence. So when we went to the reporters, they clearly said that look, the focus here is on the health crisis. And even then we tried to create the conversation that, every pandemic has an aftermath on gender impact. And that kind of lens itself is missing, that, every crisis, even when there is a natural disaster, and when there is a lockdown, when there are crises like that, a humanitarian crisis or a health crisis, we know there is a gender impact. Whether there is a lens, the gender lens to that impact within the media, is a problem. We kept specifically our partner organizations from the Northeast. They kept, we started having these internal communications within the partner organizations of NGOs, and everybody started sharing their problems. We kept telling the media that, look, the immediate help and the rescue. For example, there was a one-stop center by the WCT ministry. But if you have to go to a local NGO, if a woman is in touch with a local NGO worker, and she knows, she's aware of the problems that, she has been facing domestic violence on a daily basis, in that 5 to 6 hours that she spends time with her spouse or a family member. And just imagine that when you're trapped within the homes, confined within the homes. So we had certain evidences coming from Western countries where the pandemic was hit first. We also had previous evidences from Africa, and that sort of, our whole grudge is why there was so much delayed response. We wanted media to be the platform to tell the government, announce the local helplines as essential services. Let the NGO workers be a part of essential services, just like a lot of media organizations gave the free passes to the media access as essential services, right? So the challenge has always been different at the different levels, whether it is vernacular press. Vernacular press, we really face the mindset within the reporters. Like I've mentioned, even in my presentation, that my colleagues, even who have been a part of Breakthrough, even before me, they have had multiple sessions with journalist interactions in Uttar Pradesh, Haryana, because we've always, Breakthrough Breakthrough started with the whole thing about popular culture. Popular culture is one of our key platform to spread the message. And simultaneously, it's the mainstream media. We think that they are also equal stakeholders when it comes to dissemination of message. Patriarchal mindset within the reporters, lack of space within the print space or the television has always been challenges. Yeah.
So when you talk about the mindset issue of more localized reporting versus national media, do you think you were able to change that?
Ragini, we believe that mindsets can be changed. You know, the whole aspect.
Of course
that
they
we are
can be.
talking
That
about,
is the
that's a
point of
slow
SBCC.
process.
But
That's
what's
a
the level of exposure that you need to change it? That's maybe a more valid question.
Yes, I think how can we change the mindset is the question. And from where do we start changing the mindset? You know, when we deal with the reporters, especially on
how many rounds of interaction did you have with, say, a particular reporter? Was it one? Was it multiple?
So, you know, we have been, we believe that networking with reporters is one of the keys. When I've mentioned those workshops, you know, are held within 6 to 7 months of duration. You know, it's not possible for an NGO. But if I'm saying that, if I take, for example, there are few reporters, you know, whom we communicate, and say 6 to 8 times as a telephonic conversation. For the last 2 years, we have not been able to have that kind of a workshop. And earlier, when we used to have workshops within our intervention areas, they used to be at least 6 to 7, 8 rounds of interaction through workshops, through trainings with them. Apart from that, every time we come up with a campaign, every time we come up with a new, like for example, after our Bell Bajao, we had a Bell Bajao campaign. We had enough evidences that active bystander intervention can be a deterrent, you know, to prevent violence against women. So when we go to the reporters and we say that, you know, the bystander intervention should be promoted. Now, there are a lot of, there are challenges. What is a bystander intervention? In what capacity can you be? Yeah.
Deepali, in the interest of time, I'm going to ask you to compress this. But yes, I know that Bell Bajao was a very successful bystander intervention campaign. Vaishali, I think we have to close this session now. Is that correct? Hi, Vaishali?
Yes, ma'am.
Okay, so I can't close without thanking those of you who have presented, who have shared such important work, to those of you who attended, especially those who asked questions, and a very big shout out to Vaishali Chopra, who has supported us, you know, to bring this session to everybody, and to her team, to the new concept team, Sonali Jana, Surkhraj, who's handled all the tech. Thank you very much, all of you. And I hope you'll join us in the afternoon for the rest of the sessions. Thank you and have a good day.